Hello, my name is Kaylee, and I'm a third-year nursing student at the Pennsylvania College of Technology here in Williamsport, and I'm just going to be telling you guys about Group B Streptococcus and also provide a few tips on long labor. So let's start. The first question is, what is Group B Streptococcus? Group B Streptococcus is a bacteria found in the birth canal of some women. It usually does not cause any illness in healthy adult women. It is not a sexually transmitted disease, nor is it the type of bacteria that causes strep throat. The next question is whether it is harmful or not. Group B Streptococcus is not harmful to adults. However, babies who are exposed to Group B Streptococcus are susceptible to lung or blood infections, pneumonia, or even meningitis. How will you know if you have Group B Streptococcus? Between 35 and 37 weeks gestation, your provider will test you. The test is not painful, and it will just be done with a cotton swab inside your vagina and rectum. This test just tells whether the bacteria is present or not. So what happens if you do test positive for Group B Streptococcus? If your culture comes back positive, you will be treated with an intravenous antibiotic for prevention of the spread to your newborn during labor. You will be asked to come in during the onset of labor instead of waiting until labor progresses, so there's plenty of time for the antibiotics to work. If a culture was not obtained or if a risk factor is present, the intravenous antibiotic for prevention will be offered anyways. To end my presentation, I wanted to provide a few tips on long labor. Not all labors follow a typical pattern. Some may have a very long early or active phase. For others, it may take longer than expected just to push the baby out. My first tip is labor for as long as possible at home. This prevents you from spending even longer inside a hospital room. Rest if you can, change positions frequently. You can even go into the hall or waiting area to change the scenery. Drink lots of water to keep yourself hydrated, or eat light snacks or easily digested food if your healthcare provider approves. And a really big one is to have a backup support person lined up because your original support person may need a break. For example, your husband or your mom, they may want to take a break or go grab something to eat, so it's important to have someone else that can be there for you when you need them.